Welcome. I'm Amy Stewart-McIntosh with Kutandara, and I'm really excited to see everybody here today to partner with us on continuing to keep our studio a safe place to gather during this pandemic. And one of the things that we have done in the recent past is we hired H2 Manufacturing Solutions to help give us an outside view of what we were doing, what we might need to do, what the industry standards are, what are the current regulations. So I'm going to turn it over to Joe Jackman from H2 Manufacturing Solutions. I'm going to spotlight him, and I bet he's going to do a screen share. But Joe, I'll just turn it over to you for what is the process that you used with us, and then what were our results?
Of course. First up, like you were talking about, who are we? And Justine is fantastic at describing this. So I'm actually going to have Justine jump in here and give a little laydown of who H2 is and how we ended up where we are. And then I'll get into the details of what actually happened with the audit, the results of it, the next steps, and answer some of the more in-depth questions then. So Justine?
Thanks, Joe. I'll be brief because I know you really want to get into the meat, but I think the key thing for you guys to know, which I always start by saying, is that we built the safety system with the interests of the community and businesses in mind. We have this sort of fundamental belief that you can operate businesses safely when you give business owners the proper tools and you can keep the community safe. It's not an either or. So we've been working for over 6 months, and we always applaud Amy and Randy for having brought H2 in order to help, because that's exactly the kind of responsible business person that we've been working with. So Joe is part of the H2 team. He and a small team are those that are monitoring and managing the what we call the safety system and certification process. And we've been working with Amy for the last, about 6 weeks or so. And I think you'll be, we'll be interested to hear what your feedback is when you hear the results. So
perfect. So how this came to be is I joined the team. My background was in molecular genetics and epidemiology. And so I worked with the team to come up with some training guides, some audit rules based off of the different legislature and public health records. And we were able to put together an audit, and now I'll start sharing. So first off, we come into the facility and we actually look through a large list of criteria. In this case, the facility had 44 criteria that fell into disinfecting and cleaning, furniture, structures, and objects, occupant behavior and screening, and signage. All of these different components were rated from a 1 to 5, 1 being completely unsafe, 5 being certified safe. With that, a 1 would be no one wears their mask ever for the criteria of wearing a mask. A 5 would be everyone wears a mask at all times. Those are broken into major and minor criteria. So the ones that are more likely to cause a contagious point in a facility or spread the disease as major, and ones that are less likely but are still a possibility are marked as minor. Passed is when you have one of those 2 infractions completely safe. You have met the certifiably safe standard. So that's what a passed infraction. And we actually worked with hand in hand the Boulder County Public Health, which Boulder County Public Health happens to be the one you're in. So that means it is highly tailored exactly to the business. With that, Kutandara ended up with a 3.3 with only 6 major infractions and 20 minor. If an infraction is anything below a 5, it means it's not passed, it has a little tweak. A lot of these are very, very quick fixes, which you'll see here in a second. With an understanding that the benchmark, our first pass score for the average business, is actually a 2.7. So they started already significantly above the average company across Boulder. With that, you can see that of all things, the thing that was worst was signage, which if you see, they have the disinfecting and cleaning practices. They've taken the time with furniture, structures, and objects. And so the big one was for us was to have them help put up a couple more signs to make sure that we are abiding and everyone inside the facility knows what to do and what not to do. And to get into a little bit, just a quick overview of the major infractions. We talked about there being 6. The big ones were just making sure that the items around the facility and the kitchenette are cleaned before use. Having screening at the front door and making sure people clean their hands before entering the facility. And then a couple of signs around wearing masks, which the facility itself already wore masks, but the signs are there to help make sure we remember when someone's not looking or we forget. It helps remind us of that. So the basic premise of this is we go in, 44 criteria for the facility, 1 to 5 for everything. Ends up with your scoring and all these different criteria. And in the end, puts up a list together for the next steps. And I know Amy's been working on a lot of these already. And there are a number of minors, but we're not going to get into that today. Just talking about the couple big ones, mainly entry screening, and how making sure that no one entering the facility is a threat and is as likely to be safe as possible as a quick check before entering. Amy, did you want to talk at all about the steps you're taking at this moment?
Yeah, I actually think before we move to what we're doing, what we've done since the audit and what we're continuing to do, I think we could just pause here and ask for if anyone wants to know anything more about any of those slides or if there's any clarifying questions. Someone's asking what date was the initial audit? And I think you probably have that in your calendar faster than I can find it.
Yeah, and your furniture, structures, and objects were the highlight. You would clearly put out the social distancing between each of the instruments and all of the different varieties to make sure that you have the safe equipment, including airflow and heating and all of that.
Yeah, just a curiosity question for Joe or Justine. Did you observe any classes as part of the audit?
We talked through the procedural components of each class. The timing did not align to be there for a class itself, but talking through exactly what the practices were and identifying where there's potential risk for different movement of people, as well as if there's any directionality of where the people stand versus singing, those kinds of components like you were talking about, like the group was talking about with singing, how to help increase the safety throughout the facility in that way.
And then Becky asks, is there any audit of air quality? And I'll just hop that right back over to Joe because I knew folks were going to ask that.
Definitely, yeah. So one of the interesting components is that there is no regulation basically across the entire nation, including in our state and local county, about exactly what to do. If you look at the regulations, it states, please increase it as best you can. And that's pretty much it. So when it comes down to this, they have suggestions for filter quality. They have suggestions for a number of different things. And so when it comes to regulation, we do our best to help with airflow and what that is and how we can make suggestions to increase airflow. So when it came to it, we talked about opening windows, increasing fans, those kinds of things for what they could control. And so when it comes to HVAC, we do what we can to improve with the understanding that there's not really a consensus yet on best practices or requirements around HVAC, pretty much across the board still.
And then Charles in the chat is asking, is this a continuous improvement effort? Specifically, is there a schedule for future audits to adopt new practices, et cetera? And Justine, did you want to talk about the 5-star rating program at the county
actually,
level?
it's a great question. So yeah, so Amy, again, kudos to Amy and Randy. Our solution that we had built, I'll talk about 5-star in a second. Has anybody, first of all, heard about 5-star? Yeah, okay, good. I see Bruce shaking his head. I'll tell you about what that in a second. So prior to that, our solution is one that goes back out and we call it recertifies every 8 weeks for exactly the reason, Charles, that you're bringing up. There's actually, there's the continuous improvement part of it, but what we've learned from the other clients that we've worked with is that the changing regulations are very, very confusing. So the dial's moving, somebody put this in the chat. So when we go out every 8 weeks, we can make sure that people have adapted to the latest change, quite frankly, and make sure that they're still in compliance. And if they're not, then we can quickly have them come back into compliance. So Amy had been making that request to begin with, and we were like, sure, let me figure out a way to do this. And so what happened fortuitously is both Boulder County and Denver County are utilizing H2 as the solution for their 5-star programs, which is great because then we can take an Amy and sort of, kind of filter her right into 5-star program. And in Boulder County, they are providing as part of the 5-star program, the every 8-week recertifications. So the benefit of that to Amy is that because she's already in, she already had the vision and took the initiative, is that we'll just slide her right in and she won't have to put out any additional expense associated with that.
As we go forward, how long or what types, and also Kendall, your question in the chat about where we are in the state style and what that means, being in partnership with the county in this 5-star program and H2 manufacturing allows us to have that kind of continuous dialogue of where are we, how can we improve, is the risk decreasing enough that we can, I don't know, can we ever take our masks off again? We don't know. But can we sing? Can we be closer than 6 feet? And it's just so great to be, in on the front end of this program with H2 and Boulder County.
Yeah, and one of the things that does happen once you're in the program is every week we put out a Friday newsletter with all the updates that they need to worry about, any changes that may need to go in place, anything that new signage that needs to go up, any new practices that need to be put in place, easier cleaners to use, those kinds of things. We put that out every Friday to everyone that's been through the program. So Amy here will be able to every week update and keep up with the newest information easily.
Cool. So if there aren't any other questions about Joe's presentation of our results, I will talk about what we have done and are doing with those results. I'll just pause for any other questions for clarification. Everyone's turned their cameras off. Gotta go. It's totally fine. All right, so I'm just gonna spotlight myself so that the video catches me. So we kind of broke down those major infractions into kind of 3 categories for us to think about. And a really easy one for us to fix with H2's help was the signage. And so if you haven't been to the studio in the last couple of weeks, you'll notice we have tons of new cool laminated full color signs. And H2 had some very specific suggestions, requirements for what signs, where, and why. And so the signs that you see in the space now are a result of Joe's specific on-site audit with us. So that was a pretty easy fix because they provided us these beautiful PDFs that we just went and printed and had laminated and stuck up on the walls. So the signage stuff is pretty much all checked off. All the major and minor infractions of signage are handled. Another easy one for us to fix, which Joe, there were more in the minor infractions. Joe touched on it with the kitchenette area, was tracking who cleans, how they clean, and how often they clean the things that need cleaning in the facility. And so what H2 provided to us is this fancy interactive Google sheet that has all these logic. Heather, you probably could have done it, but Joe did it, or someone at H2 did it. And so cool input sheet where we input what with H2, what needs to be cleaned, how often, and then it kind of like populates this other sheet to like warn us when it needs to get done. And then there's a place to initial. And so that's a kind of database or, workbook that's tracking all of the disinfection and cleaning that we're doing daily, weekly, monthly, semester wise. The biggest major infraction for us to fix was actually the health screening. And for those of you who've been coming to the studio the last couple weeks of fall semester in December, got to experience that with us. We were piloting, how is this working? How can we do this? And so for those of you who've been there, you could attest to our new health screening station at the front door. So That includes a QR code that you can scan with your smartphone and do the health screening on your own smartphone. It also includes an iPad right there at the door that you can do it on the iPad. You can also do it at home with a link on the website right before you come to the studio, and all the instructions are there. There was some concern, I kind of guessed there might be some concern about who owns that data. Is it Big Brother? It's not Big Brother, it's Amy. I own that Google spreadsheet, and what that health screening form is it's a Google form embedded into the back end of our website, and it feeds into a Google spreadsheet. And so I have historic data of who is in the building when, and the answers to all of their questions. Heather, I do love me a good spreadsheet. And so I guess, Jen, in answer to your question in the chat, that is exactly what that spreadsheet is for contact tracing. It's also like a reminder of when you walk up to our door, like, do you not feel well? Do you feel a little flushed? Oh, your sister-in-law has COVID and you saw her on the driveway. It's a bit of a reminder for you to check in with yourself. Like, do I belong here? Am I well enough to be here? Have I had any exposures that might make it uncertain if I should be here? But then secondarily, and most importantly, is the contact tracing. So that's what we've done. And I think we're done. I think I've got everything checked off on your list, Joe. And so I think the next step is for H2 to come back and see if they can give us their stamp of approval.
There are a couple
Awesome.
of questions that Joe, maybe you want to speak to singing. So we did we've done some faith organizations, and so we'll just give you, since I know there's a couple questions about singing or music. Joe, do you just want to kind of give the highlights regarding that?
Of course. Yeah, so there are some interesting aspects for people that are singing in different ways. And so what it comes down to is, the interesting thing is, if you take your mask off, singing and performing requires 25 feet, which in your facility might be a little difficult. So the key factor of performing is, of course, the noise, the loudness, the projection. So when it comes to, if you start to belt and go back to that model, you'll have to abide by the place of worship, basically, the rules around performing. And that requires more spacing. So we talked about it when we were there. And as long as the chanting / singing remains talking volume, then it does not have to be construed as a place of worship performing kind of style. Unless you take your mask off, in which case it's a wide variety of what that is. Most places say once your mask is off, it's 10 to 12 feet, no matter what. And then singing becomes 25. So mask on is okay with what you're doing.
Cool, thanks, Joe. There's some activity in the chat about who should be filling out health screenings. And I just want to address that for a minute because we're making a little video. I am like the biggest proponent of young adult smarts and brains and good thinking and good decision making. So this is like a little outside of my pattern of how I normally interact with young adults. But because this topic is so heavy and this topic is so important, I want, and I've been encouraging parents to do the health screening for their young person or with their young person. So if your young person has a driver's license and drives themselves to the studio, you can do it with them before they leave the house, or you can coach them on how to do it a number of times, and then they can do it when they arrive on their own. What I don't want is a 7-year-old or an 8-year-old getting dropped off at the door and the 7 or 8-year-old doing their own health screening on the iPad. I just don't think that it's a safe way for us to take care of each other. And it has nothing to do with my lack of belief in your young person's ability to determine whether or not they have had a fever. I really want us to work as a community to keep one another safe. And I think it's important for parents to be involved in that conversation with your young people. I mean, obviously, I think parents, if you're bringing your young people to the studio, that you think that's safe for them to be there. So just go ahead and bookmark that website in your smartphone, or quickly step out of your car and snap a picture of the QR code. It takes about 30 seconds to do the health screening. So thanks for your partnership. Kendall's saying, so all students under the age of 18 should have their parents sign, I think you mean complete, the health screening, just to clarify. I'd like for young people to be in dialogue with their families about that. If you are 7 and you walk into the building and try to do the health screening on your own, I will ask you where your parents are. If you are 17, I probably won't. Justine or Joe, do you have anything to say about young people filling in their own health screenings? What the industry standard is on that?
Well, I can say more broadly, we have done a ton of schools, period. And, you know, it sort of goes without saying, I'm probably saying everything everybody here would agree with, but is like the best solution is when the parents play an active role in how their kids engage with their facility. So, you know, to the extent that they recognize that when they go into the facility, there are particular actions to take for themselves to be safe, not just screening at the door and entry protocols, but also when they get in to be using hand sanitizer, to be washing their hands regularly, to continue to wear their masks, yada, yada, yada. So we, as always, parents are an enormous influencer to the extent that which the parents are instilling those protocols into the kids before they ever even get to the facility only makes it easier for Amy, but also only makes it so that the facility remains as safe as possible.
Yep.
Yeah, and I'm just hearing from some parents who have kids in Boulder Valley School District that even at the high school level, the high school requires the parents complete the daily screening. So parents, do that with your young people before you bring them, or walk in with them, or do it in the car as you drop them off. Would you mind showing some slides of the regulations and talking about contact tracing? Because I think there's enough questions and concerns about that to just show some of those slides if you wouldn't mind.
Sure. We'll hop through some slides really quickly, and you can stop me at any point through chat or just hopping off mute and yelling. But this will be a few slides about basic safe practices, and then there will be a few slides of safe practices or how to handle COVID cases and what that looks like. So first off, the basic ones: wear a mask, stay 6 feet apart. When you can, assign seats. This is not just for the touching of the seats and how it could transmit the virus, but it's also about keeping the people who are close to each other and trying to not put each other in each other's bubbles and switching each person and increasing the chance of exposure.
Joe, let me jump in here just for a second and say, we normally don't sit when we have class, but in the places where we do sit, you'll find new signage in the North Studio in Zambezi, where you are allowed to sit, where you're not allowed to sit, and then in the South Studio in Limpopo for drumming class where you can sit. And so that's a minor infraction that we fixed. And I failed to mention it, but the signage, once you experience the new signage, friends, you'll see that.
Yeah, but no, the one with the drumming circle is to make sure the people that do sit in the drumming circle are still the safe distance apart. So what you do is you mark the floor some way to show where chairs can go.
Yeah, we've actually marked the benches. You can sit on the X's. There's red X's you can sit on.
Perfect. That's fantastic. And then, of course, common use items before and after. We want to reduce most of it's airborne. We know that the common spread is through air particles. That's why we're using masks, and we're focused on HVAC and keeping our spatial distancing, because that 6 foot allows most of the bubble of our airborne particles to settle to the ground. or be pulled out before they get to someone else, or lower in density so it doesn't cause infection. But it still does have a chance of transmitting through touching something that has been sneezed or coughed on, touching eyes, mouth, nose, those kinds of things. So making sure to clean things that are common use items like fridge handles and microwaves, coffee pots, those kinds of things. The drum mallets, which you do practice, which is fantastic.
And actually, let me jump in there too, Joe, because I also forgot to say one of the areas of concern that I brought up was, for those of you who've been in the studio, the congregating at the sink to bleach the mallets. And so we've ordered 3 2-gallon buckets and 70% isopropyl alcohol to create a different kind of disinfection station in each room. So in each room, there will be mallets and disinfection stations. So we'll have less congregating at that disinfection station that was at the sink. We're just waiting for the chemical company to send us the isopropyl alcohol. I check my Amazon shipping tracking every day. It'll be here any day. 5 gallons.
Yep. Yeah, it's good to find out what works best for each item. And with this new alcohol cleaning system, it'll make it a little easier on the cleaning process as a whole. Eating's always a threat. Indoor eating was off limits entirely during the red for restaurants. We're back to orange, so eating can be done semi-safely. But weather permitting, eat outside. You're a studio that doesn't do much for eating anymore. The barbecues are kind of gone, at least for now.
No more potlucks.
No
for a while.
potlucks for now. But in case this is for everyone, if you are at your own job or whatever it may be, remember this. You want to keep that social distancing the best as you can, because when mask comes off, it increases how far you should be to be safe based on the science we have available. And for some reason, the schools practice this, but the businesses found it too difficult, so they aren't required to do it. So that doesn't mean it's not unsafe. It's just was not required of them. So that's something to keep in mind. So eating outside or in your car or whatever that may be, it's always safer. Don't grab in open food containers, like a big bowl of chips. Washing your hands beforehand, making sure that those common use items are clean. And when there is a setup that you can afford to have individual items for each person, for instance, if you had a whiteboard, to get a black marker for everyone so they could have their own.
And some people are bringing their own mallets to the studio and keeping track of their own mallets. And I really appreciate the folks who are doing that and who can do that.
That's awesome. Yep. Makes it a little easier. No disinfecting required then, because you're the only one that's touching it. Stay 6 feet unless you need to help them. Clean doorknobs, and only use the cleaners provided by the company. And that's pretty much it. Those are the basic overview of the things to stay safe in whatever environment you are in.
Yeah, and let me just jump in and say, we did get a $500 grant from the city of Boulder for cleaning supplies, and I just got the shipment yesterday. So we are set for life on disposable masks and hand sanitizer and alcohol wipes for surfaces and alcohol spray cleaners. So that was a really smart thing that the city or county, Boulder County did.
That's awesome. So that is the regulations. Anyone have any questions on those basic practices? All of these slides will be in the video if you want to look at them and spend more time on each one. So the next section will be what happens with an actual possible case and all the different aspects of that. And I figure that'll be nice and valuable to understand it, at least, both for coming into the building as well as for your own places of work, and make sure they're safe with you. We want to make sure the community is safe, like Amy said. So first off, this is a list of all the symptoms that you can find. And when should you isolate? Basically, if you start showing any of these symptoms or exposed. The one caveat to the showing symptoms is if you believe it could be COVID, which basically means, have you come in contact with anyone in the last 14 days? If you haven't, and my example earlier was, if you've been in your own house by yourself for 14 days, and the only time you went outside was in a shorts and t-shirt and it was -10, and all of a sudden you have cold symptoms, may not be COVID. So you still want to treat yourself as sick, but to keep that in mind. What counts as exposure? Anytime when you're within 6 feet for more than 15 minutes. It used to be consecutive, and they realized that was not the smartest because someone could be in the same room with someone for 14 minutes and 59 seconds, walk outside, and then come back in. So they changed it to 15 minutes within the day, within a 24-hour period. Provided care for someone who is sick with COVID. You had direct physical contact, hugging, handshakes, whatnot. You shared eating or drinking utensils. And then if they came up and sneezed on you, that's also exposure. I think those are pretty straightforward at this point. Those are kind of the key principles that have beaten into us at this point. When to get tested? As frequently as you can be tested. We do weekly, but we interact with the public quite a bit. We don't want to be the ones coming around doing COVID safety tests and then bring it into a bunch of facilities. So we test every week. There are a number of free facilities now where you can go get testing. Other places, other times to get tested, whenever exposed or whenever you believe you might have it and have symptoms. So those are the big three. Now this, if you were to ever have it and you've been in the facility, you would want to notify Amy. She would be the leadership / COVID response team. She'll take care of what to do with the public health, which will help the contact tracing. She can also send out something called the home handout, which is where it breaks down exactly what all we're talking about here, where to get tested, if you need to quarantine or isolate, and if it affects your job, what to do. And they have a phone service you can call if you're ever confused on that home handout. So if you ever need it, Amy has it. She can give it to you if you need. And last but not least, we have the cohort tracing, which Amy has a tool to be able to send you and say, hey, is there anyone else in the facility you've been recently near that we need to understand? If you could share it, please do. It helps us understand and catch this before it spreads any further.
Yeah, and again, that's one of the main reasons that we instituted the health screening form, so that we have that data. If Kendall, for example, you call me up and say, oh my gosh, I just tested positive, I was in the studio on such and such a day, then I can go into that spreadsheet and determine who was in the space with you and after you, and with H2 and Boulder County Public Health, determine who needs to be contacted, and act, so that we can keep everyone as safe as possible.
Yep. Yeah, it's nice to have a process in place, and now Amy does. So when something does happen, she knows what to do, which is more than what I can say for a lot of places still, unfortunately. This document you can always go and look at when it comes down to it for your own place of work. For instance, if a kid gets sick or if you get sick and you have to stay home, what actually happens to you? How do you get paid? Can you get sick paid time off through the government, through your company? What does that look like? Of course, the company, each one has its own policies and can interact independently, but there are some policies that you can look at here to get more information on it. When cleaning, Amy knows to do this now. If there is someone that was just in the facility and touched all the different instruments, if possible, you actually wait 24 hours. This allows most of the virus to become inert. It denatures and is no longer virulent, so it can't infect you. For the most part, a lot of it dies off quickly. There are certain surfaces that can hold disease virulent for much longer, but they're usually at very low concentrations by then, so it's much safer to clean. If it's not possible to wait, you can use higher level PPE to go in, personal protective equipment to go in and clean. If it's not cleanable, which is very rare, but certain elements which you don't have to worry about, then it has to wait 7 days. So luckily, that's not the case with the facility. One of the last things is, when can I return to work? So if you do test positive, you have to wait 10 days from your first test that came back positive, and 24 hours without medication, without a fever, without using medication. 20 days instead of 10 if you're immunocompromised. Now, the 10 days is from the first test. So say I was tested today and I got my results back on Thursday, the 10-day clock starts today, not Thursday, because that's when the test was taken. And that's true for all of these dates. So the next one you can see, if I was exposed but don't show symptoms, after 5 days, I can go get a test. After 7 days, if it was came back negative, I can return to work or activities. I'm considered safe. If you have no tests whatsoever, after 10 days, you're considered safe. That one was updated in late November, early December. Before, it was just 14 days no matter what. They updated it to 7 days, 5 days with a test. 5 days in, you take a test, 7 days, you go back, or 10 days without.
So Joe, can you clarify if that 7 days and a negative test 5 days after exposure is a total of 12 days or a total of 7 days after exposure?
Yep. So if I was exposed today, I could take a test on Saturday and by Monday be back in society.
So it's 7 days after exposure if the test is negative. Thanks.
Yep. So 5 days after is the test, 7 days after the exposure, you're allowed to go back.
Great.
And then, of course, if you want to ever see how your friends actually know what they're doing, or any kind of test, it's up to you who gets it or how you score them. But this is a quick quiz that you can use to test the knowledge of people around the safety practices. It's a 5 to 10 minute quiz. Some facilities use it saying, hey, you need to get at least this score because the people there aren't practicing safely and they want them to be educated. Some people just use it to see what kind of holes in their community, where the knowledge gaps are.
Great.
Some people use it for fun. I don't think you know much about COVID. Take this test.
And Joe, you're going to send us this whole presentation afterward that I can pull from, right?
Yep, both this quiz and this entire PowerPoint is now in your report outs folder.
Okay, great. Thanks.
Yep. So with
Thank
that,
you,
of course,
Joe.
if you have any questions you don't want to ask here in the chat or you want to take offline, I'm always here for anyone. My mission is to help the community as well. So I'm really appreciative.
Will you put your contact info in the chat so folks can copy and paste it if they like?
Sure.
You guys have my contact info, but maybe you want to go straight to the expert. We got the experts here. Okay, well, I want to thank all of you for attending tonight. It was really important for me to make it as widely available as possible to our community, and I'm so happy to see that so many folks of different membership and groups and different generations of age showed up tonight, and I hope that you'll help us disseminate this information and knowledge to your groups and to help us, let's work together as a team to keep the facility safe and keep each other safe. I think most of you feel the same way that Randy and I do, that the music we play together is so healing and is so good for our mental health always, but especially in these times. And if we can keep our doors open to meeting in person, it's just so good for everyone. But we have to make sure that we're just staying as safe as possible to be able to do that. So thank you guys. And I want to thank H2 Manufacturing for their time tonight to help us put this together.
Amy, thank you for doing this. We're grateful. We built this for responsible employers like you.
Thanks.
And we're grateful for you helping us protect the community. So thank you very much.